Success secret number 9, vitamin D. You always seem to hear in the news that there is some new vitamin to consider or a new deficiency to worry about. But when it comes to a peripheral neuropathy, or any autoimmune condition for that matter, it's very important that patients are taking vitamin D to help their immune system. Now, modern diets are lacking in vitamin D. So what are some vitamin D rich foods? Liver. Truth be told, I do not like liver. In fact, I cannot stand liver. I'm not a big fan of organ meats. Lard's another one that has it. Also, many forms of seafood, butter, and egg yolks. But egg yolks could also cause sensitivities, but egg could be very important for you in the morning because of how it affects your blood sugar levels. So sunlight is another important factor and source of vitamin D. But you should never take a vitamin D supplement without having your vitamin D levels checked. And it needs to be checked with a vitamin D 25 OH. So that stands for vitamin D 25 hydroxy. Your ordering physician will know exactly what this is. So it is very important to have your levels tested. This way you're eliminating the guesswork. You could be low in vitamin D or on the low side of normal. Either way, you need some sort of vitamin D supplement. So why is vitamin D so important? Well, vitamin D deficiency is associated with many autoimmune conditions. Frankly, autoimmune rates have been skyrocketing in the past 20 years, which correlates with the decreased levels of vitamin D in the general population. Adequate vitamin D levels help keep the immune system in balance so it doesn't swing out of control into an autoimmune disease. When it comes to peripheral neuropathy, problems with vitamin D deficiency are worsened by genetics. Many people, especially people suffering from peripheral neuropathy, need higher amounts of vitamin D to maintain health, even if their blood tests show sufficient vitamin D. Now again, do not take vitamin D without having your blood levels checked. So you need to make sure that you take it. So in many cases, patients will come into my office with their vitamin D levels will be on the low side of normal. Now their MD will tell them, you're fine, there's nothing wrong with you. But actually, they're on the low side of normal. So they need a vitamin D supplement. I recommend that all my patients with peripheral neuropathy, or for any autoimmune condition for that matter, take vitamin D. Don't suffer another minute. Set up an appointment today at 952-949-0676.